My name is Tracy Conti, and I am the new chair of the Department of Family Medicine at the University of Pittsburgh School of Medicine and DPMC. And I will be discussing my lead fellowship project, Measuring and Enabling Trust. So in the fall of 2019, the Pittsburgh Gender and Equity Report showed that Pittsburgh was one of the worst cities for Black women to live in. And from a health perspective, this is especially noted around maternal child health outcomes. And on the heel of this, we had COVID. And so while I was aware of health disparities and what COVID brought to this conversation was really bringing this to the forefront. And so my project stemmed from wanting to tackle this at a larger level. And so what we did was we were engaged with various community-based organizations through listening discussions and found that it was a lack of trust that was number one on their agenda to help us with this. So we recognized that there was a time for change. So what if we were able to measure trust, and what if we could reshape our practice quality measures on improving trust in our communities? And that's what my project is focused on. So my goal was to utilize trust as a quality measure. And in order to do this, I wanted to implement a data-driven approach to encourage our health system to incorporate quantifiable trust measures in their practices. So how do we do this? And can we measure trust? Does a tool exist? We looked at quality measures that our shared savings program were based on, the majority of them being outcome measures such as A1C and BP control. There was also patient satisfaction, but that really focused on the healthcare experience. So then we found the person-centered primary care measure. And this was great because it was CMS MIPS eligible, it was anchored in person-centered care, and we felt that we could go to our health system to incorporate this measure. One of the things that we love that it really talked about how this practice makes it easy for patients to get care. It asks questions like, does my doctor or practice stand up for me? But it really doesn't relate to trust. And so we initiated a pilot study to see if we could quantify the PCMP measure and correlate that with a validated trust tool. And the answer was yes. In our small pilot study, it did correlate. So we proposed this project across our system to be able to utilize the PCM measure in order to measure and improve trust over time in our communities. So what happened with this project? Well, of course, with any system, there is going to want to be financial accountability. And they had lots of questions about how big was this going to be? How much was it going to cost? And will it save them money? So where are we today? Well, I'm still waiting. We were able to put in a grant that was geared to our strategies of reducing health disparities. And we were informed that we made it to the second phase, but we're still waiting. And so while I would love to come here and present to you a nice package tied in a bow, that's not my reality. And so we were advised to look at these projects in terms of how it would help us grow as leaders. So I focus on these two leadership competencies and skills. So the first was leadership and administration. And what I learned was that we can't just sit back and expect things to happen. If we see changes that need to occur, the only way we can get those things implemented is to go after them and to do them. And the other was management. And while I knew I worked for a complex organization, this project really allowed me to see how the puzzle pieces fit together and actually where they didn't, which ultimately is going to help me in my journey as a chair. There are going to be barriers in any change process. And this project really allowed me to figure out how do you work through barriers and identify them. And so there are two: project scope and system change that I want to address. So project scope, our system is an enormously large system, over 700 practices. And even in this scope of practice at health disparities, we were looking at 3 distinct areas, but that had over 50 practices. So where do we start? Where do we implement? The other is facilitating system change. Change is hard. Changing structures that have been in existence for such a long time, like quality measures, are even harder. But with voices from the community in leadership, you can change them. So while I'm still waiting, I know that, there's still a lot of stairs to climb, but I do see that our system is willing to look at changes and there's light at the end of the tunnel. So thank you for listening to my project.